Communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members, such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Hello, everyone. Good morning. Welcome to another Health Hour session with CAMS. That's the Caribbean and African Health Network. Yeah? Can everyone hear me and see me clearly?
Yeah, we can hear you.
Great. Okay, so awesome. Yeah, this is an interactive session. I'm Dr. Sarah Oloto. I'm currently in London, specializing in psychiatry. It's really interesting to hear see where everyone is dialing in from. If we can put it in the chat, that'll be great. This is also a live streaming session on YouTube, so feel free to share the link with your friends, family, colleagues, anyone that will be interested. Nice, I can see people turning in from Salford, Manchester. Okay, awesome. Yeah, I'll introduce the topic and the speaker in a few minutes. But like I said, it's an interactive session. Today we'll be talking about thriving through menopause, which it's a very fitting topic. And as we know, tomorrow is Mother's Day. So it's going to be an enlightening conversation. Our speaker today is Dr. Joyce Ameh, who is a GP and specialist in menopause, passionate about empowering people regarding women's health issues and menopause and lifestyle medicine. Yeah, so this will be amazing. I'll introduce Dr. Joyce now to start the session.
Good morning, everybody. I hope you can hear me. I have been on this platform a few times in the past, and it's always a pleasure to be here amongst us all and to spread what little information I have around. And today we're going to be talking about menopause. I have spoken about menopause on this platform before, but it's not new. It's never changes, and it's an important topic. So we're going to talk about how to thrive in the menopause, Let me just get up my slides. There we go. All right, so you've heard about me. My name is Dr. Joyce Ameh. I am an NHS GP. I specialize in menopause and I run a menopause clinic, but I'm also a lifestyle physician, believing in non-medical ways to tackle some diseases. And I've been a doctor for, oh gosh, many, many years. Let's just put it that way. And why is it important to talk about the menopause? I think it's important for all women, regardless of the age. If you are not up to 40 yet, it's something that you will go through in the future by God's grace. It's something that all women will go through. If you are above 40 and less than 55, you will be going through some of the changes of the perimenopause. We'll talk about the definitions in a minute. So it's something that you will be facing imminently. Most women above the age of 55 should have gone through it. There are some late ones, but by 55, most women would have gone through it. And it's important to know what you've gone through and to encourage other women who are going through it. I think being in a community, learning about what our bodies are going through is so important. And it can also help to ease some of the symptoms that you may be facing. So, some of you may be lucky, you don't have any symptoms, you're going through it just like your periods or your pregnancy. Some women have a normal time and some women have a really awful time. So it's important for all women to understand, and men as well. It's important for the men to understand what their significant other may be experiencing. So it's a very, very important topic. And why now? It's important because people are living longer. In the 1930s, most Black women would die young. They are exposed to extreme lifestyles, and they may not be lucky enough to go through the menopause. But now women are living longer, and it is better for us to understand what our bodies are experiencing so we can live longer, live better. So it's an important topic. And menopause is a topical issue. You can't go, a week without somebody talking about the menopause. So it's very, very topical. There are menopause classes now, menopause doctors, menopause services everywhere now. It's becoming a very topical issue. And as people are living longer, we're finding that it can affect you both physically and mentally. And so it's so important that they don't lose women when companies don't lose women just because of the menopause. It can be managed and the symptoms can be tolerated. Okay. So what is the menopause? Let's understand the definitions first. It means the stopping of menstruation, the pausing of menstruation. That is menopause, when your periods stop. The average age is 51, although I do know women who are in their late 50s still having regular periods, and they haven't gone through the menopause yet. And you can have symptoms of what we call the perimenopause up to 10 years before you actually go through menopause. So most women in their 40s, they will be experiencing some symptoms. You might not be aware that they are symptoms of the perimenopause because some of them can be quite subtle, but you will be experiencing some symptoms of the perimenopause. That's the duration of time before you actually stop your periods. That's what we call the perimenopause. Now, severe menopausal symptoms are not common, but they are there. I remember once I was in a clinic and I was talking to a patient about the menopause, and she just said to me, "Doctor, just look." And all of a sudden she turned bright red and sweat was dripping from her hair. That's severe. It's a severe symptom. But even the less severe symptoms can affect women, and it's important for us to know what we are dealing with. So menopause is the absence of menstruation for up to 12 consecutive months. And I was listening the other day to a talk, and a woman I don't know who, everybody's a specialist now. And she said is when you don't have a period for 3 months. And that is not true. It's 12 consecutive months. So if you've not had a period for 6 months and then you start having periods, you have not gone through the menopause. You are still in the perimenopause. But if you've gone 12 months not having periods at all, we can safely say you have gone through the menopause. The perimenopause, though, you have the fluctuations in your menstrual cycle. Most women, their periods become heavier. Sometimes the periods become light. They become infrequent, when before you can up to the day or the minute you're going to have a period. When you're in the perimenopause, it may change. So your periods may come every other month, every 3 months, or every 6 months, or every 2 weeks. There is a change in the frequency of your menstrual cycle, and that's the perimenopause. And it's all due to the fluctuations in the female sex hormones. We'll talk about that in a minute. Now, if you go through the menopause before you are 40, that's a significant issue. If you're not up to 40, before you're 40 and you've gone through the menopause, we call that premature menopause. And it is significant because we need these hormones for good health. And you probably need to be on HRT. If you go before 45, between 40 and 45, we would say you've gone through the menopause early. And it doesn't have as much health complaints as premature menopause, but it's still significant. So early menopause, you're not up to 45. Premature menopause, you are not up to 40. But most of us, when we get into our 50s, will go through the menopause, and that's the right age. Physical symptoms, we all know. The physical symptoms of the menopause, the hot flushes, when your body just becomes very hot and you start to sweat, the aches and pains, vaginal dryness, hair loss on your head, and hair growth on your chin. It's a shame. You had gorgeous, luscious hair when you were younger, and all of a sudden it starts to thin and break. And you start developing a mustache or a beard. And you see women with hair all over their faces. We call it peach fuzz, all over, become hairier on their face. You stop sleeping, or you don't sleep so well, or you wake up very early. You find it difficult to fall, to get to sleep. Your palpitations. And as I mentioned before, your periods cycle changes. They become heavier or irregular. And then some women, they start becoming incontinent. So they start wetting themselves when they don't want to. And looking at these symptoms, each and every one of them is a reason why a woman would tend to see the GP. Let's say she starts to have headaches all of a sudden, or she starts to have she's not sleeping so well. And they're all individually reasons why you would see your GP. Why am I incontinent? Or why is my period becoming so heavy? But we have to look at the whole picture. And menopause, unfortunately, is the major cause of women attending, one of the major causes of women attending GP surgeries in the later years. Oh, another slide showing the physical symptoms, and we can all relate to them if you're in the menopause. Night sweats, which are mainly hot flushes, but they occur at night. Joint muscle aches and pains. You find that a lot of women, when they start going the menopause, they become their joints become not so strong, and they start developing these sprains. They get sprains easily. They get fractures easily. They have what we call plantar fasciitis, which is heel pain. A lot of times they get a lot of injuries in the gym. Headaches, we've mentioned before, gritty eyes, which is really due to dry eyes. The hormones are necessary for good moisturizing of parts of your body. tinnitus, which is ringing in your ears when there's no sound, but only you can hear that. Thinning skin, which we've mentioned earlier. Itchy skin, which is another symptom of the menopause that you may not know, but you sometimes feel as if you've got ants crawling under your skin. It's a known condition which occurs in the menopause. Weight gain, we women are always struggling with weight, but the weight gain in menopause is a little bit different and it's challenging, and it's a weight gain in your abdominal areas, which is the worst area to gain weight. Urinary frequency, urgency, and cystitis. It's also an issue. We've talked about incontinence because the receptors for the female hormones are on every cell in the body, all over the body. And they're also on the bladder, on your, the way where you pass urine, urethra. And so when you find that you're going through the menopause, when your hormone levels drop, you're getting all these symptoms, which can be a big issue for many, many women. Oh, a hot flush. Most women will experience at least one hot flush. It's a sudden feeling of heat. You might be in a meeting or watching television or in a restaurant, and all of a sudden you feel exceptionally hot. Caucasian women will actually turn red. It's not so common amongst the Afro-Caribbean, and you start to sweat. Some women during a hot flush can start to lose focus, or become a little bit depressed or anxious, and you lack concentration. And it can occur at any time during the day or at night. It lasts for a few minutes, and some women don't have hot flushes, and some have them multiple times in a day. It can occur at night, which we talked about, night sweats. And you may continue to have them for several years after your periods stop. So it can be a big, big issue for many women when they're going through the menopause. Hot flushes. Imagine you're in a meeting, or for example, like myself, I'm giving this presentation, and all of a sudden I start to have a hot flush. I start to feel very hot, start to sweat, lose concentration. It's not a nice thing at all. And it can also, menopause and the perimenopause can have a significant impact on a woman's mental health. Imagine if you're having hot flushes, you're having palpitations, aches and pains, you're not sleeping well at night, you start to have low mood, you feel very anxious, you can't concentrate, you can't think. And I didn't mention on this, you can have some memory lapses. You going upstairs to get something from your room, and once you enter the room, you've forgotten. Oh, what was it that I wanted to get? All these can have an effect on a woman's mental health. You're not sleeping well at night, so during the day you can't concentrate and you make poor choices, especially when you don't sleep well. We know there is a big connection between sleeplessness and poor choices. And I'm talking about dietary choices, lifestyle choices, because you really can't, be focused on a healthy lifestyle when you just want to have a good night's sleep. So yes, the perimenopause can have a significant impact. And in the olden days, we used to have, when we weren't prescribing so much HRT, a woman would come with symptoms of not concentrating, low mood, mood changes. One minute you're happy, next minute you're sad, you're not sleeping well at night, don't really feel joy. And we think, oh, this is a depressed woman. And we put them on HR and put them on antidepressants, many women on antidepressants. But we now know that this is what happens in the menopause. And anecdotally, I find that women who have struggled with their mental health before they go through the menopause tend to have a harder time during the menopause with their mental health. But even women who never had mental illness will find that sometimes they feel a little bit low and depressed during the menopausal years. Oh, another slide showing the effect of hormones on the brain. Now, I mentioned that you have hormone receptors on every cell in your body. You have them on your eyes, which is why you get dry eyes during the menopause. You have them on the bladder. You have them on the intestines. You have them on your brain. We know that estrogen is very, very good for brain health. It helps with learning. It helps with fine motor control. It helps with memory, which is why we suffer a few times when going through the change with memory lapses. It helps with sensitivity with pain and coordination. And it's also protective against dementia and strokes. It's one reason why when you are younger, your risk of getting dementia, strokes are low. And when you go through the menopause, your risks increases significantly of dementia and strokes. Progesterone has a calming effect. So generally when you are low in progesterone, you get angry a lot. And it has got a sedative effect as well, which is why, you struggle with your sleep. It helps with anxiety, stress, and fear. So hormones are very, very needed in a woman's health, especially. And mental symptoms, we talk about mental health and significantly talking about mental health because we don't want doctors to be prescribing antidepressants unnecessarily. Sometimes it's other things that might be needed in a perimenopausal woman, for her mental health. But we suffer from mood swings, foggy thinking. We start a sentence and then you forget what you were saying mid-sentence. Poor sleep, we've talked about that, especially struggling to fall asleep, or you wake up for some reason 3 o'clock. It seems to be the time that women wake up, 3, 4 o'clock, and you might struggle to get to sleep. It could be a hot flush or a night sweat that wakes you up in the night, or because you've got urinary frequency, you need to go to the toilet a couple of times in the night and you struggle to get back to sleep. Loss of libido, you don't feel good about your body. The last thing you want to do is have intercourse with your partner. Irritability, depression, anxiety, snapping. You could be having a great time and all of a sudden you get angry. Unreasonable anger, seeing red. And there's an overwhelming loss of confidence and low self-esteem because you don't know what's happening to yourself. You might be thinking in your mind that, am I turning mad? Is something really seriously wrong with me? And we've mentioned that if you are somebody who unfortunately suffered from mental health, we tend to find they worsen in the menopause. So I've given you all the bad things that can happen in the menopause, but it's not all doom and gloom. And for one, if you are going through the menopause, I would say you are, blessed. It's a blessing to go through it. You've reached a grand old age. You've reached that age where you can go through the menopause. Some women, unfortunately, don't live long enough to go through the menopause. So it's not all doom and gloom. We'll talk about the benefits of the menopause later, but what can be done? Now, I told you earlier on that I am a lifestyle medicine doctor. I do believe in lifestyle medicine, and I do believe that a healthy lifestyle can minimize the effects of the menopause. Now, I said minimize, not negate, not get rid of them, because they are symptoms that we will experience. But I find that women who have an unhealthy lifestyle, so women who smoke, who are overweight, who perhaps don't have a good work-life balance, they're working all the time, or very sedentary, they don't do much exercise, they tend to have worse symptoms than a woman who exercises and is not a smoker and minimizes the amount of alcohol she drinks, and has a good work-life balance. So it's never too late to incorporate a healthy lifestyle in your day-to-day life. And none of this should cost extra money. But a healthy lifestyle can help with your tolerance of some of the symptoms that you're experiencing in the menopause. And they can help to keep the heart and bones strong, which is what we need. You know, we don't want to have a fracture or a sprain when we're going through the menopause. And it includes eating calcium-rich food. So food like dairy products, if you can have dairy, yogurts, which is excellent for your health. Eating oily fish, I put there at least once a week, but really we should be eating it at least 3 times a week. Oily fish, such as your mackerel, your salmon, your sea bass, and limit your salt and saturated fat. And also eating fruits and vegetables. Looking at your plate. Does your plate have different colors on it? Does it have your reds, your greens, your oranges, your purples, your blues? Try to eat different colored foods, because we know that these colored foods contain what we call phytochemicals and phytonutrients. So they're nutrients that are contained in fruits and vegetables, and they are really good for your heart health and to protect against cancer. Also, I advise you to up your fiber. Eat fibrous food, your oats, your barley, your bulgur wheat, whole grain foods. And these are really good for gut health. And just an aside, gut health is probably the most important when we're talking about health in general. And it is the biggest source of serotonin, which is the hormone which is needed to feel happy. Your gut, it is the biggest source of serotonin. So if you got a healthy gut, you are less likely to be depressed and suffer from low mood. And the last thing is, you should be eating protein with every meal, especially as women. We don't want to start losing muscle tone, or our muscles will start becoming weaker and weaker, which we call sarcopenia. And sarcopenia actually starts from the age of 35, when your muscles become weaker. You find you can't open a jar of beans, or you find you can't lift an object like you did. So eating your protein is so important. Protein with every meal. In fact, if I have a take-home message, one take-home message, it would be eat protein with every meal. So your breakfast, yogurt, eggs, fish, in fact, everything I've written down, beans, nuts, and seeds with every meal. Well, you don't have to eat each and every one of them, but increase your protein intake. That is important. So that's what you can do. That's what everybody can do, whether they are on medication to improve the symptoms or not. Everybody can do this. Also, these are a little bit different lifestyle measures, which I mentioned earlier. Stopping smoking. I mean, I don't know why you're smoking. There is no benefit. But stopping smoking, I would say, is also a significant benefit for all women. Exercising regularly. The more you exercise, it helps your muscles. It helps your muscles, helps your bones, and helps your heart as well. Boost your mood. Reduce alcohol intake. Definitely. We find that if you drink a lot of alcohol, you do tend to have a lot more hot flushes. So reduce it or cut it out completely if you can. Some women find that spicy food induces a hot flush. So if it's something that you can do, try and reduce that. Even hot drinks, some women find makes them have a hot flush. So if you see a connection between spicy food, hot drinks, hot food, then it's something you should address. Other things, normal things that we would recommend: wearing layers so you can take off easily and put on. When you have a hot flush, you take off the layers, and when you start to cool down, you put on the layers. Keeping the room cool, switch off the heating in the room. Use a fan, go around with a fan to cool you down. Lukewarm, not hot showers, and practice self-care. We'll talk about self-care in a moment, but self-care practices are so important. Now, none of these will get rid of all your menopausal symptoms, okay? But they will reduce them significantly, and they will give you the strength to go through it. Nothing is forever. I am a menopause doctor, so I will talk a little bit about HRT, and I would say if you can take it, take it. If you can take HRT, take it. You're going through the menopause because of a reduction in your hormone levels. If you are lacking calcium or you're lacking vitamin D, your doctor will prescribe calcium and vitamin D. If you are going through the menopause, you are lacking your estrogen, your progesterone, and therefore your doctor will prescribe HRT. It is the most effective form of therapy for the menopause, but you don't have to take it. And some women are unable to take it. For example, I would not give a woman who is morbidly overweight and smoking HRT. It's just not done. And there are some women who have had maybe some autoimmune conditions or some cancers. We need to go through your risks, but majority of women should be able to take their HRT, and they should take it if they can. HRT relieves the symptoms due to an estrogen and progesterone deficiency, which makes sense. That's the menopause. You're going through the menopause because you are lacking, or your levels of estrogen and progesterone are reduced. And therefore, to treat it properly, you need to replace those therapies. Okay? It improves your mood, improves anxiety, it improves depression, it improves your hot flushes. It also improves your sleep. And it has long-term benefits. You have a lower risk of fractures, especially associated with osteoporosis, which is common after the menopause. So it is something I know a lot of Black women are not fans of it, but I would recommend it. If you can take it, definitely take it. And there are various forms of HRT now, tablets, gels, creams, sprays. I would advise that you get specialist advice. Okay. I am a doctor, but I'm not your doctor, so I can't prescribe for you, but get specialist advice. You might be surprised that you can take it, and it will make a world of difference. And the best time to take it is when you are in the perimenopause. You can take it at any age, well, definitely not when you're younger, but the best time to take it is when you still have some hormones flowing in your system in the perimenopause. Okay. So it's definitely something you should consider. Now, I mentioned self-care, and this is a slide that shows all the different types of self-care, and it's so important for women, especially women, because we like community and we like to talk. And it's good for us to reconnect together in ways that will benefit us. So two women are different. No two women are the same. Some women find that they are energized by going into meetings or meeting up with a friend. And some women find that they are energized by reading a book, taking time out, going to a jacuzzi, but there are different ways. Find out what's what benefits your body. And there are various ways of self-care. And pick up a hobby. Do something outside work which you enjoy doing. Be creative. So in working on your self-care will also help with the menopause. It's also a lifestyle measure, which I mentioned earlier, which all women can do. So not all women can take HRT. If you can, you should. But you can all have a healthy lifestyle, definitely. Do I have any other slide? Oh, and I was going to talk about the menopause. If you have seen me talk on menopause, you would have seen this slide. It's not all doom and gloom, okay? When you go through the change, another word for the menopause is the change, your periods stop. So there's no need to stop buying your pads, your tampons, your cups. All those have changed. No more PMS. If you are somebody who suffers from PMS, that goes out of the window. You don't have it anymore. You can have sex without thinking that, oh, I might get pregnant. Now, this is for menopausal women. If you're in the perimenopause, you can't get pregnant. And in fact, unfortunately, the perimenopause is a time when quite a lot of women get caught out. They have no periods for 6 months or so, and they think, oh, I'm now through the change. And unfortunately, and also, for some reason, you might get twins. But that's aside. Your uterine fibroids, women, especially Black women, tend to have fibroids, causes heavy periods, pain during your periods as well, and they shrink because they are fed by the hormones, and the hormones are no longer there. Greater self-assurance. You feel you're older and you're wiser, hopefully, and you're more mature. So that's a benefit. Your children will be older, your more senior positions at work, you have a little bit more time to focus on caring for yourself. You're not running around taking them from one place to another, thinking about what they eat, most women. And time to take risks. This is a slide I put it, a little point that I put in. All this time you've been thinking, oh, I can't do this, I can't do that. Now, why not? Pick up an instrument, learn a language. I'm currently learning Spanish. Don't know why, but I'm learning Spanish. Everybody in my house is learning Spanish right now. And I am a Christian woman. Might be a time to take up ministry. Look into ministry, look into serving others. We do know that serving others is a form of self-care. Even though you're looking after others, it actually comes back to you. So it is so important, I think, the menopause. So there are benefits. It's not all doom and gloom. It is something to look forward to. I'm going to be older, wiser. The Bible tells us, one woman, you need to look after your other women, definitely. So there are benefits of the menopause. Sounds counterintuitive, but it's a good place to be. And that means you've lived a reasonably long life if you're going through the menopause. Not that long, but a reasonably long life. And that's it. It's a whistle tops talk of the menopause, going through the different types. My take-home message is your lifestyle measures. Be more aware of how you eat, what you eat, how you drink, what you drink, what you weigh, how much is your weight, whether you smoke or not, sleep or not. Focus on the basics, and you will find the menopause is not as difficult to navigate as you may think. And that's it. Any questions?
Thank you, Dr. Joyce, for that wonderful, enlightening session on menopause. I mean, menopause has been such an underlooked topic, and many women didn't have so much information, but now it's coming into light. Thank you for going through all of the physical and mental symptoms, the symptoms that are not so obvious and the ones that are salient, and scientific basis, hormonal, chemical changes that goes on in a woman during menopause, including estrogen and progesterone. And you stressed mainly on the importance of lifestyle, and healthy, balanced diet, including calcium, fish, vegetables, protein, and fiber, and all the healthy self-care measures. And you also mentioned about hormonal replacement therapy, which a lot of women didn't know about. So that is good that this is an alternative, or rather a treatment option that is available for women. Yeah, and I can see some questions. Please feel free. There's also the reactions you can use if you want to speak. Let me read. I can see a question from Evelyn. Is intermittent fasting helpful in dealing with stubborn belly fat and weight loss?
Yes, intermittent fasting is hello. Intermittent fasting is definitely a tool which you could put in your arsenal that can help to improve your weight loss and actually improve your response to hormones. So it is definitely useful. It's not something I'm talking about today, but if you can intermittent fast, which is allow your stomach or your intestines to rest for part of the day and then eat for the other part, it's definitely a helpful tool.
Okay, thank you. We have a hand up, Bisola.
Good morning. Really great session. And I'm going to be borrowing a lot of sentences from you today to use in my consultation next week. I hope you can hear me.
Yes,
okay,
I can.
So my question is around, you mentioned briefly about the being obesely overweight and the risk factors that they are. And now, I guess, of course, there are different forms of HRT. And therefore, would you advise not to start someone for that reason, or would you go down the path of choices?
Yes, definitely. I won't start HRT on a morbidly obese woman.
Mm-hmm.
Morbidly obese woman. If you're mildly obese and no other risk factors, then I probably would consider HRT for you. But if you are morbidly obese, that itself is a significant risk factor. I wouldn't give HRT. So I know I've said HRT is a good option when you're talking about menopause, but it can have some risks. So we always go through an assessment, your blood pressure, your weight, see if you're smoking, have you had your cervical smears, have you had your mammograms? There's a whole long process. And if you don't have any risk factors, then yes, we would give you the HRT. But for me, some other doctors may be different. I wouldn't give a morbidly obese woman HRT. I would focus first on getting that weight down. And you find that lots of times when you actually reduce the weight of a woman, the menopausal symptoms do reduce. So it goes hand in hand.
Thank you so much, Dr. Joyce. We have a few questions from socials. The first one, I'm 42, I presume, and my periods are all over the place, sometimes heavy, sometimes missing for months. My GP says it's probably perimenopause, and I feel like I have to mourn my youth. I'm so sad. Can I take hormones to turn it around? Something you've mentioned.
That's a good question. And the answer is yes. You can take hormones to improve the frequency of your periods, but is that why you want to take the hormones? Is it just to improve the frequency, to have them every month? Because if you're having them infrequent and you are covered contraception wise. I wouldn't mind not having a period for a couple of months and having it. So you've got to find out the reason why. And there's no need to mourn. You know, menopause is a period that most all women should go through. And it sounds like you probably are in the perimenopause, like we mentioned, but that can last up to 10 years before you actually go through the menopause. So I think primarily for you, I would be looking at making sure you're covered contraception wise. And one of the ways in which we give HRT is by giving the two hormones, one with the Mirena coil, which is the progesterone, and then we can give estrogen with a gel or a tablet or a cream. So that's something you can discuss with your GP.
Wonderful. Another question. My mom went through menopause at 45 and I'm 40 now. Should I expect the same?
We know that early menopause can run in families, but we need to look at the circumstance of why your mum went through the change at 45. Could it be that she was stressed? Could it be that she had other medical issues? If she had none, then it's likely that you would go through the change earlier. But, you know, there's no two women that are the same. But early menopause does generally run in families. And if you find that your mum went through it early, 45 is early, then you've got a higher chance of going through it early, but doesn't invariably mean that you will.
Okay. Thank you. One question I believe is about egg freezing. She says, I'm well in my 30s and not ready for kids yet, but menopause might be around the corner. Is egg freezing worth it? And does being black affect how well it works?
Oh. Well, I'm not a gynecologist or an obstetrician. I'm just a lowly GP. If you're in your 30s, then menopause is not around the corner. You've got a good 20 years before you go through the menopause. So I wouldn't be recommending egg freezing. I'm an NHS GP, so I wouldn't be recommending egg freezing unless there is something that you're not telling us that you're worried about. But no.
Oh, thank you so much. That looks like all the questions I'm seeing on here. I do have a question or an insight. I mean, menopause is something all women should be aware of, regardless of the age. And I know in terms of the age range, there's early menopause, and it's not normal for women to have early menopause, and that could be that there's some medical condition that predisposes them to have that. Do you know of the percentage? Is early menopause really common?
Yes, it's commoner than we think. Early menopause. It's just a lot of women go through it and that's it. The problem with early menopause and premature menopause is that you're going to be longer in the menopausal phase.
Right.
And we've talked about how important these female hormones are for our health. They're everywhere. The receptors are everywhere in our body. So if you're going through early menopause, I would be recommending HRT. I'll be going through an assessment for you, and I'll be recommending HRT at least until you're 50. And then you can make a decision whether you want to stop, or continue. But it's important if you're still in your early 40s, if you go through the menopause, you're too young and you should be having a replacement. But not all women can. I know women who have unfortunately been on treatment, chemotherapy, and sorts of stuff, who go through the change early and they wouldn't be able to take the HRT, especially if it's female cancers. So it's a challenge for those women. But it's not all doom and gloom. At least the lifestyle changes that I mentioned can help everybody, whether they can whether you go through the menopause early or prematurely, or you go through at the normal age. Or even if you're menopausal right now, when you're listening to this talk, they will help you. I'm not saying everybody needs to be on HRT, but I think more people should be on it than actually on it.
Exactly, especially once they're experiencing those mental symptoms that you've said, anxiety, depression, a lot of sleeplessness. HRT helps target those, and women's life are completely changed instead of depending on those antidepressants. Thank you so much. One more question by Bisola. Which is more accurate, checking for hormones or stopping the period for 12 months? Most definite for confirmation of the menopause.
So it depends on the age. In the NHS, so we do things differently in private practice than we do in the NHS. In the NHS, if you are in your 50s and you stop your periods, what's the point in checking the hormones? There's probably no point unless your periods are a little bit infrequent, then you might check it. But if you're young and your periods are infrequent, there's no need to check it because they won't really tell you the facts. 1 minute your hormone levels are high, the next minute they're low. So if you do a blood test when your hormone levels are high, we will say you're not going through the menopause. But then you might not have a period for 2 months because your hormone levels are low. So there is a fluctuation. So we don't recommend blood tests in women below 45. Above 45, then yes, we need to know whether you are actually in the menopause or not. So we will do blood tests then.
It looks like that's all the questions I can see so far. Thank you so much, Dr. Joyce. This was a very, very great session. Yeah, so I could hand over to Stephen from the CAHN.
Thank you so much, Dr. Joyce and Dr. Sir, for that amazing session. What a great time it's been. Thank you. Can you see my screen, please?
Yeah, but you sharing your Teams.
Sorry.
No secrets were revealed. Thank you, Stephen.
All right, thank you. You can see that now. Are we good? Can you see my screen, please?
Yes, we are.
Okay. Thank you, Dr. Joyce and Dr. Sarah. That was a great session. We surely can't wait to see you next time to impact us with knowledge to make us better when it comes to our healthcare and our well-being. Thank you so, so much. And thank you everyone for being here. Next Saturday is going to be another time, health hour, same time, 11 a.m. to 12 noon, and that's April 5th. Please kindly invite your friends, invite your family members to be part, excuse me, part of this. This is a great platform for members of our community to share knowledge and make our lives much better. Let's go to this. Yes, the Black Healthcare Awards 2025 is here. This is the second edition, and what a great platform for us to celebrate our own. This putting spotlight on our Caribbean and African healthcare professionals across UK. We are saying, let us showcase our very best. So the nominations now open. Please click on the link, scan the QR code, tell someone to nominate. You have someone out there who you strongly believe has been of great value to the healthcare industry here in the UK. So nominate that man, nominate that woman. We have a whole lot of categories across across where you can, from doctors, nurses, senior or junior healthcare providers. Please, let's us put spotlights on them. They are doing amazing jobs. That will be at the Park Plaza in London, July 12th. So nominate and let's celebrate our very own. Here at CAHN, we strongly believe that no one should be alone. That's why we have the bereavement support group, where you can always reach out to someone, and there will be someone to listen to you. You don't have to grieve alone. Have you recently lost experience? You're experiencing grief. It's a free online session holding every Monday, and the next one is on April the 7th. Services include grief counseling. We have support group, and there are resources to share where, to make bring comfort. So you don't have to be alone. Kindly reach out. You can reach out to a colleague, Roslyn, on roslyn@can.org.uk. It's an online session that holds every Monday, 7 p.m. to 9 p.m. And remember, it's Women's Month, Women's History Month, and the Empowered Voices panel shared a whole lot of stories to encourage and motivate us. So please click on the link. You hear different stories from survival stories that will motivate and encourage everyone. So please do not hesitate. If you need more details, kindly send a mail to dvsa@can.org.uk. You will be glad you did. And if you do not know about our Green and Arts Wellbeing Service, wow, a whole lot is happening there. This is where you come out and join people of like minds, and every Wednesday from 2 to 4 p.m. in Bolton, and at Stockport is every Tuesday between the hour of 1 and 3 p.m. It's a moment of fun, art. Just come have great time together. Come and don't stay in isolation. Come out and have fun. There's someone out there who is willing to make you feel livelier, to impact our well-being, positively. You can send a mail for more details. Kindly send mail to Green and Arts Wellbeing at can.org.uk, or call Lola on 0778997520 for more details. And that's it for this week. It's a wrap. Thank you so much, everyone, for joining. It's been a great time. Next Saturday, join us once more between 11 a.m. and 12 noon for another memorable and great session. Thank you, everyone. Bye. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.